All right, this next one we're going to do is taping for a wrist, and we're going to do this for following a couple of injuries. You could do it following anything where you're falling on that outstretched hand where you have your wrist extended. So we could be doing it for support following Colles fracture, so fracture of the radius and ulna. We could be doing it for an injury of your TFCC, which is your triangular fibrocartilage complex, which is at the end of your ulna. It could be for following a fracture of one of your carpal bones. Most commonly fractured one is your scaphoid. That's the one that's here in your anatomic snuff box. So lots of different things. Wrist sprains are pretty common though, and oftentimes some athletes just want their wrist taped into neutral. That's pretty common with linemen, so we can do that as well. First we're going to use pre-wrap, and then we're going to use the tape. In order for the athlete to be comfortable and for you to be comfortable as well, and they don't use their shoulder too much, they can keep that relaxed, they can make their hand straight, and you can just park it against your belly. That's kind of helpful. They want their hand to be wide and spread so that muscles and tendons are wide here. Remember that our forearm is wider at the top, and then it narrows, and then it widens a little bit again. So any strips that we put around the wrist are not going to be straight across. Instead, we're going to angle them a little bit. Pre-wrap. This is the first time we've used the pre-wrap. This is comes off the roll just like the elastic wrap does on the bottom. You don't want it to get very far away from you or we'll lose control. It's a little bit stretchy, it tears very easily, and it sticks to itself kind of with static. So what we're going to do is start this, when we're putting pre-wrap on, it doesn't matter if we start distally or proximally. So we're going to start at the proximal end, and we're just going to wrap around, kind of overlapping by about half. Once we get down to the wrist, we're going to come up here, and then we're going to go around the hand, and then come back around. You can go through once or twice, kind of make a figure eight there. If somebody has a very small hand, you might want to tear that a little bit so that it doesn't bunch up by the thumb. Right here, you see how that kind of rolls in like that? All you have to do is just pinch that off, and then it doesn't do that anymore. So anytime your pre-wrap starts to wrinkle or bunch or pinch, you can just pull that off. We're going to do some anchors to start. So I'm going to go at an angle. I'm going to angle this around. You can see it's kind of a little bit of a chevron shape there. You can put your fingers back in my belly like that. And then I'm going to go one more. And then I'm going to have an anchor around the hand. And when I put the anchor on the hand, I'm going to have him make his hand wide and then turn it with his thumb facing up. This is something where we're going to just put a circle around the hand. You're going to fold this part in based on the width of the person's hand right here. And just make a circle. So I just have one strip of tape, and it's just going around in a circle. So do you want to turn that over so you can show them what it looks like on the other side? There we go. The other thing that you could do, if it works well and it's not going to wrinkle, go ahead and thumb up again. You can do a figure eight. So I can go there, lay this down. When I'm pulling it through the hand, I don't want to yank on it here and make it really tight. Instead, I'm going to pull on the tape while my other hand is holding on to it. And then I'm going to come around and I can finish that figure eight. So either one of those is fine. Depends on how I injured, or how the athlete injured his hand, on which direction I'm going to go now. If it was a fall on an outstretched hand, he did it by extending through the wrist, and so we want to prevent extension. In order to prevent extension, we're going to turn it over and use flexion to help him stay out of that mechanism. How we're going to do that is a series of strips that are going to go on the anterior side of his forearm. I can do this on his hand, or I can do it on the table and lift it up. It's up to you. If I do it on his arm while he's sitting here, I'm going to measure the length of the strip. Then I'm going to tear it off, and I'm going to start at his hand. I'm going to pull him into a little bit of flexion here, and then I'm going to pull it and then anchor it up here. If it's a little bit longer than the anchors, that's okay. We can always fold it over at the end. Now I'm going to do the same thing, only this time I'm going to do it in an X. So I'm going to start a little bit on the outside of his hand, and I'm going to pull into flexion and make one side of the X, and then I'm going to do it on this side, pull, and then make the other side of the X. All right, so that's going to prevent him from going into extension. All I have to do is cover those spots up and hold those strips in place, and it will do its job. So these are our locking strips, and you can just go all the way down. Tape that is just put on the forearm or the wrist here. See how that doesn't go around? I'm just going to let the tape kind of go where it wants to go, because wrinkles and windows and holes and things like that are what cause blisters. So don't force the tape to go, just kind of let it go where it wants to go. Anyway, tape that's just on the wrist and doesn't cross up to the hand really has no impact on motion. It's just, it looks good. Doesn't really do much. And I'm going to put another one of those on just to keep it secure. This tape is seconds, and so it doesn't, it falls apart pretty easily. There we go. Now, this is functional, but it's ugly, and so this is part science and part art. So what I would like to do is just put one more nice strip up here so it looks a little more finished, and it's a little bit less apt to catch on things. Okay, now see if you can bend your wrist backward. So stops it from bending backward as far as what it was before. You can do the same thing by applying strips the same way on the outside, and then you'd have opposing forces, and that would hold it into neutral. So this is a really basic, easy way to do it, but you can control motion with it this way. You can add more onto the hand or the thumb, or you can keep the wrist just as it is. For now, we're just going to keep the wrist as it is. All right, the first video that we're going to do is for the shoulder. We're going to do an elastic wrap for compression, maybe to help with transport immobilization if we're trying to get somebody home, or to the doctor, sometimes to hold an ice pack on. If that's the case, we'll put an ice pack on here and then just use the elastic wrap to hold that on. There's also the Flexi-Wrap, which looks like saran wrap on a stick, and that's what you most commonly see on a sideline if you're watching a football game or a baseball game, what they put the ice pack on the pitcher's shoulder with as soon as they're done pitching. We're going to do 2 wraps. They look very similar, but the line of pull, the direction of pull is going to be just opposite for each one. So the first wrap that we're going to do is going to be for a shoulder dislocation or for an AC sprain. Remember, the mechanism of injury for a shoulder dislocation most commonly is abduction and external rotation of the shoulder. So we're going to want to prevent that from happening. Could also be a fall directly on the shoulder, and that would be an injury in the AC joint or an AC separation or an AC sprain. So let's start with the elastic wrap. This one's not very stretchy. When you're doing an elastic bandage on somebody, you want to make sure that you do it with the tail coming off the bottom. If you do it coming off the top, you can get too far away from the joint, and then typically what happens is you just drop that and it gets away from you and unrolls. So we want it to come off the bottom. So what we're going to do is go around the bicep one time. You can make a little dog ear here by folding that over, and that will help to stay on a little bit better. So right now I am pulling from lateral to medial, or from outside to inside, the opposite of the mechanism of injury for the shoulder dislocation. Can you put your hand on your hip, your left hand on your hip, please? Then I'm going to come up and over that shoulder, and then I'm going to come underneath the left arm. I'm going to pull it across the back, across the front of the shoulder, and I've got an X here where the injury would have occurred. I'm going to go back underneath. I'm going to continue following, overlapping by a little bit each time, being careful not to bunch it up so it's uncomfortable. But you'll see a couple of X's starting to form. And then I'm kind of pulling each time as I come around. It'll go around about 3 times, and then you can finish off on the arm. You don't want to finish off on the chest or on the back because it'll be too easy for it to unravel. We're just going to tuck it in for our purposes. If I was going to send him home with this, or try to hold it on with an ice pack, or even send him out to play, which you can do, I would follow it around with elastic tape to hold it on a little bit more securely. So right now I'm going to have him try to lift his arm up and come into that same position of shoulder abduction and external rotation, like you're going to throw. It's a little harder. A little harder to get there, offers a little bit of support.
Yeah, it's like a rubber band.
So that one's good for dislocation, subluxation, AC sprain, holding on an ice pack. If you're starting the athletic training program in the fall and you can put an ice pack on a shoulder and hold it securely there, then you're already useful. So good thing to practice. The next one that we're going to do is the same wrap, but in the opposite direction. What you would want to do this one for would be for a rotator cuff sprain. Remember, injuries of the rotator cuff are typically overuse or repetitive stress injuries. Somebody using their arm up over their head. So a pitcher, a thrower, a volleyball player, a tennis player, a swimmer. And what we can do here to support that is take a load off of that posterior cuff that has probably been stretched and stressed and is painful by helping them with their posture. So we're going to do the same wrap, we're just going to do it in the opposite direction, and it's going to feel really different. So again, the tail's coming off the bottom. I'm going to wrap around once, fold that dog ear down, wrap it around again, and then I'm going to start to head up over the front of the shoulder. This might also feel if we had a long head of the tendon of the bicep irritation. That can be part of impingement, or it can kind of live on its own. We're going to wrap around again, come across the front side. This time I'm pulling that shoulder posteriorly and aiding with external rotation. So I'm putting it in a position that it doesn't naturally do on its own. Requires some muscular effort for it to get there, which is why posturally we don't do that very well. Come around. So 3 times around, probably, depending on the person that you're wrapping and what length your wrap is, and then we'll finish it off here. So now what this one should feel is like it's easier to hold your posture and your shoulders not falling forward quite as easily. So that's the shoulder. Beneficial to hold on ice pack, help with posture, immobilize to transport, and to provide support and to prevent motion if you're trying to prevent someone from subluxing or dislocating again. We're going to tape a thumb now. The thumb injury we're going to tape is for a gamekeeper's thumb. This is an injury of the ulnar collateral ligament on the medial side of the thumb. This is your metacarpal phalangeal joint. You have an ulnar collateral ligament in your, on the medial side of your elbow as well, but this is the one in your thumb. This is the one that quarterback Drew Brees injured in the fall season in 2019. So when this happens, your thumb gets pulled away from your hand, and it can sprain, which stretches this ligament, or it can rupture. If it's ruptured, it needs to be repaired because we need this ligament in order for us to grip things. So to pick something up or hold something. In order to set this one up, what we're going to do is have him hold his hand like he's holding a coffee mug. You can use some pre-wrap or not. It depends on how much hair is on the person's wrist, really. All we need is one anchor strip that's going to go around the wrist. So I will use a little bit of pre-wrap there. We're not going to worry about using it on the thumb. So here, all we need is just a strip that goes around. So we have something to lay our thumb strips down onto. For the next part of this, we want tape that is either 1-inch tape or 1.5-inch tape that's been bifurcated or split in half. So that's what we've got here, is 1.5-inch tape. That's your just standard white tape. I'm going to cut it in half. I'm not going to pull it while it's on his thumb because it's very easy to get it too tight and cut the circulation off on their thumb. So I'm going to start over here at the ulna, and then I'm going to come around on the inside of his thumb. I'm going to come up around the thumb. I'm going to stay above the joint, tear a little more off here, and then I'm just going to lay it down across the front of his hand and finish where I started. You want to turn your hand toward the camera so they can see what it looks like on that side. So that's one strip. 3 or 4 strips is probably plenty. Common mistakes that people make are making a teardrop sort of shape that looks like this and comes down. That doesn't have any impact on motion, so that's not going to help us. So we want to make sure is that what we're doing is having impact on the motion. So I'm going to overlap this a little bit, starting again on the ulna. Then I'm going to come a little bit higher on the thumb, just very lightly wrapping it around, pulling it off, using my other hand, come around, and then finish. So can you pull your thumb really far away from your hand? Can I pull it this way? Kind of that direction, it kind of stops it, right? And what about this way? So keeps it more into that thumb shape. If you find that it's not impacting motion enough, then you can change that angle. You can also go the other way. You can alternate. I find that this way has more impact though. Around, and then I can come a little bit further this way and kind of really pull that toward the ulnar side again. So if I'm using the same roll of tape, it makes sense to just do 4 strips because then I'm back to a full piece of tape again. There we go. And then all I need to do is to hold that on. Just put 1 more strip around. And we're good to go. So there's taping for your gamekeeper's thumb. The last hip wrap we're going to do is for a high hamstring strain. And the hamstring does hip extension as well as knee flexion. So we're going to be wrapping the top part of the hamstring where the origin is that assists with that hip extension. So we're going to start with the leg that's been affected in an extended position. So unlike the other 2 where we keep the affected leg in front, this time it's in back. Same idea here, coming off the bottom of the roll, going around the thigh a couple of times before going up around the trunk. So wrapping it around here, a little dog ear, come around, and then we're going to go up to the opposite side, hip flexor, or hip iliac crest of your hip, X around, and come back down. So we're making the X where the painful spot is. So here it's pretty low. I think I can squeeze 1 more. No, that time it's going to end on the top. So we're just going to finish around the thigh. This should help prevent, if you're moving forward, too long of a stride or too far of a kick. and prevent that hamstring from stretching, and it should also assist the hamstring with hip extension. So try to take a step forward and see what that feels like.
Ooh.
And that's the end of hip wrapping. All right, the next hip wrap we're going to do is for the hip flexor. And so we've got about 4 different muscles that work together to flex the hip, bring the knee up, and that can be easily strained. Similar to other field and court sports, you can wear this for practice or game, or just to have some more comfort after somebody's had a hip flexor strain. So we're going to start in a similar way. The heel is going to be elevated, but this time the foot's going to point straight ahead. So you're just going to point straight ahead. There we go. And instead of going from lateral to medial, this time we're going to go from medial to lateral. So I'm going to start down around the thigh and wrap around. Do the dog ear again. And then I'm going to aid the hip flexors by helping them and lift up. So this is the line of pull here, lifting up, and then same thing, wrapping around top of those iliac crest. Down around the front, making an X right where the hip flexors are working. Wrap around, and then tug up before you go around the trunk, and then one last time around, give it a tug up, all the way around. And then again, if I had elastic tape with me, I would have put that around there, but instead we're just going to tuck it in and see if it helps the hip flexors. I'll give us a demonstration of how it lifts your knee up. This wrap is almost out of elastic, so it's probably not as dramatic as what a new one might be. Now we're going to do wrapping for the hip. We've got 3 different ways we're going to do this. The first one we're going to do is for the groin. The second one is for an adductor, or a groin is an adductor strain. The second one is for a hip flexor strain, and the final one will be for a high hamstring strain. So all 3 for musculotendinous strains. These can be used during practice and game situations if necessary, or just used to hold ice on, or to give compression and support for someone just to get around while they're healing. They can help prevent motion, which we'll show will be beneficial. For the first one we're going to do is a groin or adductor strain injury, and those are the muscles on the medial side of the thigh, and when they get stretched or overworked, they can become strained. What we want to do is prevent them from stretching in an abduction manner. So how to do that? The word groin has the word in it, so that's going to help us to remember to internally rotate the hip, and by doing that we're going to have his foot point inward, so rotate your foot so your toes are there, and then we're also going to have him elevate his heel onto a block of tape. You could use anything for this. And that will keep his hip and knee flexed. I'm going to use the same wrap that we used for the shoulder, the 6-inch elastic wrap. And for this groin, we're also going to try to remember to go to the inside. We're trying to pull his hip inward so that we're preventing it from doing the painful motion. So we're going to start down on the thigh, and we're going to wrap around once, doing the dog ear with that, and then again, and coming around so that that will stay on there. And then we're going to head up to the top of his iliac crest. So if you just ask the athlete to put their hands on their hips, then you'll know where the iliac crest is. Okay, and now you can let your hands down. So I'm going to pull across and then wrap it gently around. I don't want to pull too tight across his abdomen because it might make breathing a little bit uncomfortable. I'm going to come down, come around, and then right here is where I'm going to give it a pull again. This will pull that leg toward the midline. Around again. You may have enough to go around a third time. If you do, that's fine, but you just don't want to finish on the torso. You want to finish down on the leg. So We'd come down here. Ideally, I would finish this with elastic wrap and go all the way around to retrace what I did to hold it more securely. But for now, we're going to tuck this in and see which direction it feels like that pulls your leg. So, can you feel it pulling in?
Mm-hmm. Push
Okay.
it this way.
We're going to tape for an arch support. This can be beneficial for plantar fasciitis, so pain on the bottom of the foot, starting at the insertion on the heel, and sometimes it creeps forward all the way up to the base of your toes. Can also be beneficial for shin splints or medial tibial stress syndrome. Posterior tibialis tendon, which is right in here, is oftentimes a culprit with shin splints. It wraps around your medial malleolus and then comes under here and attaches right here in the middle of your arch. And so oftentimes when this tendon is irritated, when the arch collapses or flattens, if you have a navicular drop and that flattens down, it puts a lot of stress on this tendon. So supporting that through the arch is one way to help support shin splints. You do not have to use pre-wrap for this. I'm using it just because it makes it much easier to take off. I wouldn't use it if I was going to send somebody out to play and their feet were going to sweat, but we'll use it here. So it doesn't matter again if you start distally or proximally. I'm just going to try to cover the back of the heel because that's where the bottom of the foot and the back of the heel are where we're going to have all of our strips of tape. So the first thing that we're going to put on here is an anchor strip that's going to go right at the base of all of your toes where they come in with your metatarsals. So I'm going to bring, these strips are not going to come all the way across. Instead, they're going to fold over, and in trying to keep them from wrinkling, what you can do is bifurcate the tape right here and fold one side down and then fold the other over, and that nice little X keeps that tape flat, which is going to keep that from wrinkling and then causing a blister. So that's our anchor, and then from here what we're going to do is bifurcate the tape again and make a teardrop that's going to form from the base of each toe and make a loop around the back of the heel and then come back to where it started. So I'm going to start here underneath his big toe and wrap around and come up. I see a wrinkle on the pre-wrap. I'm just going to tear that off so it doesn't cause a blister. I'm going to alternate my tape so I can use one side and then the other. Going back around the heel, right about at that Achilles tendon insertion. If you had somebody who had a much smaller foot, you might be able to do 3 or 4 strips. You could use 1-inch tape to do this too, so you didn't have to bifurcate the tape. I've got 4 strips on there right now, and you can see how they're overlapped and making X's. Put your foot over there to the tape. And it's forming a longitudinal arch. Come back here. I'm not going to put a 5th one on there, just so that my tape is all in one piece again. So the next part of the tape is for the horizontal arch. I'm going to start at the base of his heel, and I'm going to go from the outside of the foot to the inside of the foot, from lateral to medial, and I'm really going to kind of tug up on that medial side. Overlap by about half. And then that last strip up here on the top is going to be to hold those strips on. So I'm going to come around here. That side will lay down pretty flat. This side wants to be bifurcated again. Don't want to pinch the little toe. So this would actually be fine from this direction to just put a sock on and go ahead and play. If I had elastic tape, I would run that around that just to hold it on there and keep it in place. But this tape will serve its function right here. So arch taping, sometimes I call it low-dye arch taping. Your textbook has an example that's very similar to this. There are many variations on this, but they are all there to serve the same purpose, to support the longitudinal and horizontal arch. We're going to talk about the ankle now. This is a taping that we can do for an ankle sprain. Most common ankle sprain is a lateral ankle sprain. Mechanism of injury is plantar flexion and inversion. So here, here, and here. That's the most common way, and that's for the lateral side. We have your anterior and posterior talofibular ligaments and your calcaneofibular ligament here. Your anterior talofibular ligament, your ATFL, is the most commonly injured of the three ligaments with a lateral ankle sprain. With a medial ankle sprain, you have the deltoid ligament, which is a series of ligaments that serve the medial or inside of your foot. Mechanism of injury here is usually eversion, which is coming up and away like that. And then the last ankle sprain that we usually see is called a high ankle sprain or a syndesmotic ankle sprain. And what happens when you have one of these is that you get the syndesmosis, is the ligament sort of material that's between your fibula and your tibia up here. And so it's the ligaments that are up high that are injured, not down below your malleolus, but way up here. The most common mechanism for that is dorsiflexion, really extreme dorsiflexion with external rotation. So I'm here and then my foot rotates away. So usually it's with a foot planted and then rotation added on top of that. Most commonly, again, is your lateral ankle sprain, so that's how we're going to tape it. I'll point out one thing that we would do differently if it were a medial ankle sprain. When we tape ankles, typically we would have a tough skin spray or a quick drying adherent that we would spray that would help things stick a little bit better. It's really messy, so we're not going to use that in here. The next thing that we're going to apply is a heel and lace pad. These are like foam squares about the same size as a square of gauze would be, and it's got a little bit of lubricant on it to hold it in place. I'm going to put one, they're called heel and lace pads because you put one on the heel and one under your laces. And the purpose of those is to help prevent friction in the places where most of the bending occurs at the ankle, and so rubbing and blisters can form there. We're going to do pre-wrap on here. The most important part from the athlete's point of view is to keep their foot in dorsiflexion the whole time that we're taping them. That's because plantar flexion is the position that they were in when they were injured. So we're trying to keep them away from that position. So let's just put the pre-wrap on here. Coming off the bottom of the roll again. It doesn't matter if you go from distal to proximal or proximal to distal with the pre-wrap. I'm just putting it on. It doesn't matter what pattern you follow. It doesn't, as long as you're avoiding any rolling like this, pinch off, and avoiding any bunching or looseness. You want to come up right to the base of where the Achilles goes up and splits into where your gastrocnemius and your soleus come off. So just on the tendinous part. Once you have all the spots covered, you're good. There's no magic in having more or less on there, just enough to do the job. Then we're going to come in and place the person's foot in the position we need, and we're going to apply some anchors. So we're going to have 2 anchors at the top of the ankle. The ankle is like the wrist in that it is not cylindrical. It is kind of got a changing shape to it. So you want to follow the angle and make sure that it doesn't get gaps in the back. If you go straight around, you would have gaps forming in the back. Then I'm going to have an anchor down here at the bottom. This is a loose anchor. I'm not pulling tight on it. One of the common things that happens when people are learning to tape ankles is we get it too tight out here along the base of the 5th metatarsal, and then it's just painful. So keeping that loose enough right there. The next part of the taping technique is called stirrups. These are going to go from medial to lateral to help us pull that athlete into eversion out of inversion. Inversion is the position that they're in when the injury occurs, so we're trying to pull them out into eversion. If I had a medial ankle sprain, I would just pull equally on both sides, keeping him in neutral. But I'm going to tape for a lateral ankle sprain today because that's the most common one. So I'm going to start on the inside. I'm going to pull it up, give it a good tug, and then tear. And I'm going to overlap by about half, and I'm going to cover both the medial and the lateral malleolus. So sometimes a little bit of sculpting, some heat from your hand helps that tape to stick. This is a modified basket weave. If I were doing a true basket weave, I would do the next set of strips alternating with the stirrups. So these are the stirrups. The next ones we're going to do, I'm going to throw just a single anchor strip across the top here to hold those in place. Now what I'm going to do are the horseshoes. Horseshoes are strips that go in the opposite direction that's shaped like a horseshoe. And their purpose is to kind of cover the back and the sides of the foot so that we don't have any spaces showing before we start doing figure 8s and heel locks. I'm going to do these from medial to lateral. I'm going to go from my anchor around the back of the foot and then onto the anchor again on this side. So just going to come around right here. So some people do horseshoes, other people do what are called C-strips. They're the same thing. C-strips, people generally start from the top and work down. But if you start on the bottom and work your way up, what you're doing is helping the lymph system to push any swelling out. And that might be beneficial. I'm just going to do one more here, and then I will have everything covered that I need covered to do our next sets. Now, I've got some space down here on the bottom of the foot that I want covered because I don't want the heel locks to cause a problem down there. All right, so that's stirrups, horseshoes, and now we're going to do figure 8. The figure 8's purpose is to try to prevent too much plantar flexion. So I want to make sure that I have him in full dorsiflexion before I put the figure 8 on. A figure 8 is just a circle around the foot and a circle around the ankle. I like the idea of always trying to remember to pull up on the outside because we're trying to prevent pulling inwards into inversion because we're taping for a lateral ankle sprain. So I'm going to start on the top of the foot, and I'm just going to make a circle around the foot, and then I'm going to angle up and make a circle around behind the back of the ankle, and then just tear where I stopped. So that's your figure 8. I would typically put 2 of those on. I'm going to put 1 on right now because I'm going to do it in a different way here in just a minute. The next thing we're going to do are heel locks. Heel locks are the most important part of taping for an ankle sprain, and that's because they lock the subtalar joint into neutral. The subtalar joint is the joint between your calcaneus and your talus, and that's what does inversion and eversion, and we want that to stay into neutral. So how we do that is, I'm going to trace this with my pre-wrap so you can see what it looks like. If I start on one side, I'm going to go around and lock the heel and come back up and finish where I started. So that's one side. And then if I do the exact opposite, come down, lock the heel, and come back up where I started, now I have two teardrops, they're opposing, and when I yank on this, this pulls the calcaneus or the heel into eversion. If I pull on it the other way, then it pulls the heel into inversion, and the combination of the two locks it into neutral. So with tape, what it looks like, I'm going to have a little steeper angle than I did with the figure 8. So I'm going to put my tape on here and angle back toward the heel, come around the edge, and then back up to where I started. When I do the other side, it's got that diagonal there. You'll know you've done it if you have a diagonal. When I do the other side, I'm going to start with this angle here, go down, catch the heel, and then come up on the other side. Came up a little high, that's okay. It still does its purpose. So I would do the figure 8s in the heel locks separately until you've practiced enough that you know what they're doing and you're comfortable with them, and that you're not getting the tape too tight. Once you've learned how to do that, you can link them all together. I'm going to show you one figure 8 and heel lock that I can do with one strip of tape. So I'm going to start here with my figure 8, circle around the foot, circle around the ankle. I'm going to wrap, if my angle's good, I can just come right down and do a heel lock there. This is really not coming off the roll very well. Come around the back side, angle down, and then all the way back up. So that's a combination of a figure 8 and a heel lock on each side. So those are all of the parts that need to be covered. From here, all we have to do is close off anything that's showing. So I'm just going to do some strips around. When it looks pretty, it probably won't cause any blisters, and that's what we're after. It also won't get caught on your sock when you're putting your sock and shoe on. So these are just called closed.